I was involved in a production that I was costing and acting in and basically putting on the complete production, and the production failed. And due to financial resources, the sponsors pulled out, and I didn't let anybody know this. I just pretended and carried on. And I went into what I now know to be a terrible low and decided that I was going to kill myself. Well, later on in the day, I decided that I couldn't do it. I rang my father, and he then got in touch with the police, who were already looking for me, and they picked me up, and I was sent to the Southwest Sector Recovery Group at 380 Streatham High Road, which is a mental health unit, which is for where I first met Davina Blunt, who is the occupational therapist. Davina's helped me in lots of different ways, some of them very small, but all these smalls have ended up into one big large. She basically went through with me, and we found that it wasn't depression. I ended up being diagnosed with bipolar disorder. I certainly didn't know that I had bipolar. I knew that there were things wrong with me and I wasn't the same as everybody else, because I would do ludicrous things, tell pointless lies that I knew would be found out, and put myself in situations where I would get to a stage where I think, well, I need to end it all because that's all I want to do. As my occupational therapist, I feel that Davina has done so much for me. As I say, small things that at the time I didn't really take a lot of notice of the difference that they were making to me. But as a whole, with everything that she did, with all the effort that she put in, with trying to get my mind into some sort of state and order where I could function, has just helped me immensely, and I wouldn't be doing this one-man play now if I hadn't had that help from her. So I owe a huge debt to her as my occupational therapist.
Occupational therapists work with people like Matt who have poor mental health to help them manage their condition, live independently, and where appropriate, return to work. Occupational therapy also reduces the need for care from mental health teams and further referrals. Occupational therapy, providing positive outcomes for people and value for money for service commissioners. Occupational therapy, providing positive outcomes for people and value for money for service commissioners.